Hi, my name is Teresa Brannon. I'm the manager for training and technical assistance at the National Center for Health and the Aging, a project in North American Management. And I would like to thank all of you for attending this webinar today for senior health literacy and how much do you and your senior community understand together. We are very grateful for having Cindy Brach from ARC and Ellen Langhans from the Office of Disease Prevention and Health Promotion. Cindy Brach is a senior health policy researcher at the Agency for Healthcare Research and Quality, ARC. She conducts and oversees research on health literacy, cultural and linguistic competence, system design innovations, and Medicaid and state CHIP. Cindy leads ARC's health literacy and cultural competence activities, where she developed the ARC's Health Literacy Universal Precautions Toolkit. She serves on the Institute of Medicine Roundtable on Health Literacy, and she has co-authored an IOM publication called 10 Attributes of Health Literate Healthcare Organizations. Ellen Langhans is the Program Manager for HealthFinder.gov at the Office of Disease Prevention and Health Promotion in the United States Department of Health and Human Services. In this role, she manages the content updates to the HealthFinder.gov site, assists in ongoing outreach efforts, and leads efforts of a website refresh which launched in December 2012. Ms. Langhans received her MA in Health Communication from Emerson College in collaboration with Tufts University School of Medicine and her BA in Communication from Simmons College. This webinar today, Cindy and Ellen will focus using simple healthcare terms when you are discussing prevention and treatment programs to your senior population. Many seniors, as we know, need basic information to help them make appropriate healthcare decisions. Using simple health terms can reduce the confusion when you're talking to your senior population. Health literacy is about a combination of skills, reading, listening, and analyzing in decision-making that can assist your clinical staff in their communication process within your senior population. Good communication skills from the health center clinicians and other staff members will assist your senior population in making well-informed healthcare decisions. It is important to be sensitive to everyone when it comes to discussing health issues. Cindy and Ellen will focus on the importance of promoting good, strong health literacy within your health center.
Hi, this is Cindy Brach, and thank you so much for joining us. Health literacy is a real passion of mine, and I would say there's no audience I'd rather be talking with than community health centers, who are really at the forefront of delivering services to vulnerable populations, and particularly those who have a lot of health literacy needs. So I'm going to be talking about three basic areas. One is just to give you a little bit of background on health literacy. Some of you may be familiar with these concepts, some of you may be new. Spend the majority of my time talking about tools that you can use in your practice settings to try and become a health literate organization. And I'll talk a bit more about what that term means. And finally, to end with kind of a vision for the future of where we're all striving to get at. So begin with the basics. You have in front of you a definition of health literacy, and this definition in varying forms has been around for about a decade. And the most recent version is from the Affordable Care Act, and this version added the word communicate, so that we have the degree to which individuals have the capacity to obtain, communicate, process, and understand basic health information and services needed to make appropriate health decisions. So I want to point out that this is not just about literacy, it's not just about understanding the written word, and I think that addition of the word communicate really helps emphasize that we are talking about exchange of information, and that includes verbal communication as well. So you're now looking at some data which is, again, about a decade old, but is the only national assessment of health literacy for adults. And on the far left-hand column, you see the statistics for the total population. So the top bar, which on my screen is a medium blue, and I know colors can look differently depending on your screen settings, but that is showing that only 12% of American adults are proficient in health literacy. And by proficient, we don't mean, that they're superstars. It means that they have the capabilities to do the health literacy tasks and that the healthcare system requires of us today. So just using the materials that are out there, that are published, navigating the system, that only 12% of us have those skills. And fully a third of us, so that the sort of bottom two colors which show basic and below basic levels of health literacy, what we call limited health literacy, are very challenged in the current environment. If you look on the far right-hand side, you'll see, or going from left to right, you'll see how limited health literacy increases with age. That is, as we are dealing with older people, as we ourselves age, we face a drop in health literacy. So it's pretty staggering that the over 75 population, fully 70% of them have limited health literacy, and only 1% are proficient. So, while the message I'd like you to take away from this is that at any age people can face health literacy challenges, but that these are multiplied when you're dealing with an elderly population. So what is the significance of having limited health literacy? Well, my agency does reviews of research and produces evidence reports, and we have consistently found that people with limited health literacy receive poorer health care and have poorer health outcomes. So this is not just a nicety. This is really affecting their lives and their well-being. On the good side of this research is that we're starting to see some interventions that can make a difference, so that there are things that we can do to reduce the disease severity that will decrease the number of emergency room visits or hospital admissions, and help people get the preventive services that they need, etc. So that is what we're aiming to do. And this graphic here sort of shares with you my perception of what we in the healthcare field are aiming at, because although the definition of health literacy sort of talks about individual skills and abilities, and the National Assessment of Adult Literacy measured those skills in terms of print material, health literacy is dependent not only that, but also on the difficulty or the complexity of the health information, so that if we have a high level of difficulty and complexity, that is going to result in lower health literacy, fewer people being able to understand and use health information. Similarly, if we can decrease that difficulty, make it less complicated, then we're going to increase health literacy. And that's what we're trying to do, because we'd like to break out of this cycle of crisis care. This picture comes from an article that was published in Health Affairs, and I should clue you in that whenever you see something in yellow that's underlined, like in the bottom right-hand corner here, it says Co et al. 2012, that's actually a live link to that resource. So if you're watching this in PowerPoint, if you download the slide set or it's been sent to you, and you click on that, it will take you directly to that resource. You have to, though, be in the slideshow mode for that link to work. So that's a little warning there. So this is showing this crisis that happens all too often, and I think you're probably familiar with it as a patient, if not as a staff member, which is, a patient comes in to get medical help. They're asked to complete forms that they find confusing. They're diagnosis is given to them in language that they don't understand. They're given lots of prescriptions and sent for referrals, and at no time does the clinician stop and confirm that the patient is understanding all of this. So when the patient gets sent home with complicated instructions and nobody follows up, and then we shouldn't be surprised if the patient is not taking their medicines correctly, not following up on appointments, not doing what they need to self-manage their conditions, and they get worse, and they end up going to the emergency department where it all happens all over again. They get a new treatment plan, more referrals, more prescriptions, and again, without that confirmation of understanding, without that follow-up, and we're back in the loop again. So that's what we're trying to change. And so the next part of my presentation is talking about some tools that can help you think about what kind of changes you can make in your organization to break out of that cycle. So the term a health literate organization was sort of coined by a group of us from the Institute of Medicine's Roundtable on Health Literacy that wrote a paper, and it's, you know, that there's the link to it on the IOM's, the Institute of Medicine's website. And the idea that it's not, you know, we can't just be well-intentioned clinician and staff members and we're going to, you know, try and use plain language and you know, take our time with patients and that's going to do the trick. That we need to act on a system level, on an organizational level, and defining a health literate organization as one that makes it easier for people to navigate, understand, and use information and services to take care of their health. So we came up with a list of 10 attributes, as we call them, of a health literate organization. And you can see here in this picture, these attributes are depicted as the foundation of that organization, that if we really want to make changes, break out of that cycle, we need to have all these building blocks in place. So I'm not going to be able to talk about all 10 of the attributes, but I'm going to go through a few of them and alert you, probably too quickly, but hopefully enough to whet your appetites to some of the resources that are out there for you. So the first attribute has to do with leadership, and I think probably any of us who have been in an organization understand what a difference it makes to have leadership behind some kind of change that we want to make, so that leadership can make it a clear priority that this organization is going to value effective communication. We can assign responsibility for oversight of health literacy, and that doesn't mean, you know, it's one person's job but not everyone else's job. But it means that there's some authority, some accountability. It could be, you know, and there can be a group of people. It can be part of everyone's, you know, performance evaluations in different ways, but that somehow we are, as an organization, are going to be held responsible and responsible for meeting certain goals that we set. And we're going to allocate the resources, both fiscal and human resources, that are needed to accomplish those goals. So, you know, that's the 30,000 foot attribute of trying to get to a health literate organization. And the Centers for Disease Control and Prevention have developed a planning tool for organizations that want to, you know, think about how to address health literacy across their organization. And it's not rocket science, but it's someplace to you know, put down sort of what are you committing to? Who's going to be doing this work? What process are you using? What resources is it going to take, just to sort of get the ball rolling? The second attribute, the critical word here is integrates. Because as I said, you know, you don't want to shunt health literacy to the side as being this sort of special add-on project that, you know, will get cut or disappear if the person in charge of it leaves, or is just this discrete thing that doesn't really change the way that you're delivering care. Health literacy needs to be part of all aspects, the planning, the evaluation, your patient safety activities, your quality improvement, and really integrating it. And part of this making it integral into your operations is being able to assess how are you doing as an organization. How are you going to measure success and whether you've improved. So there are a number of different assessment tools out there. A number of them are listed in the 10 attribute papers on the IOM site, but I'll just parade this one in front of you, which is one that ARC developed for pharmacies. So the idea here is that there are going to be 3 sources of information to assess. If you have a pharmacy at your center, you might want to ask, use the audit tool that's included in this assessment user's guide. There's a little survey to get pharmacy staff input, and then importantly, you want to get patient, the clientele's perspective on how the pharmacy is doing, specifically from a health literacy perspective. So how they're doing the verbal, written, access, communication piece. And I should mention that these this assessment tool is part of a set of tools that are available through ARC's Pharmacy Health Literacy Center. And I'll mention another one of the tools in a few minutes. So, I just alluded to getting patients' perspectives, and really, I believe that understanding and getting information from patients on which to base your quality improvement activities is critical. And so we here at ARC have developed a special supplement to our surveys that capture patients' experiences of care. So the CAPS, it refers to a family of surveys, and we have them for different facilities and different diseases, or depending on what the orientation is of what you want to measure. Here it's measuring a clinician or group or clinic, and we drilled down on some of the basic questions that were already included in the core instrument to say, did your provider explain things in a way that you could understand, to try and get at some more detail. So there's an example here for if you're asking questions of somebody who's come for care because they were ill or they have a health condition, and asking them specifically about the instructions that they received for that condition. Were they easy to understand? And how often did this provider ask you to describe how you were going to follow these instructions? And this is a method sometimes called teach back or teach to go, or chunk and check. There are various different strategies for doing this, but basically the idea here is that you cannot know whether someone is understanding you unless you get them to tell you what it is that they think that you've said. Asking, do you understand, usually will get a nod of the head regardless of whether they understand. And we know that there are often huge discrepancies. I mean, we had an ARC-funded survey, sorry, not a survey, a study, where we looked at a group of patients and said, how do you think you're supposed to be taking your warfarin, your medicine for blood, keeping your blood thin and preventing clots? And they said, this is what I think the doctor told me to do. And then they checked the charts and found that 50% of the time there was disagreement. We're not talking about people who missed a dose or decided not to take it anymore, or whatever, just people who had a different understanding of what it was they were supposed to do. And I've actually had to do this myself recently, of teach back medication instructions because I wasn't sure that I understood how, and discovered that in fact I hadn't understood it clearly. And we'll come back to teach back a little bit more, but moving along to the next attribute here, this is about preparing the workforce and largely having to do with training. So, we hope that to begin with, you're hiring people who are diverse and have some expertise in the area of health literacy, but that you also need to think about how to train people at every level of your organization, not just your clinicians, but also your receptionists, also your board members, to everybody to kind of understand the importance of this work and how they can contribute to it. And hopefully, take advantage of the trainings that are out there, such as this free training that's available from the Health Resources and Services Administration that provides continuing education credits and covers health literacy and cultural competence and limited English proficiency. So you sort of get a 3-for-1 in this, and you can take it at your own speed at any time. And there are other resources out there as well. So moving on to the 5th attribute of a health literate organization. This one is one of the cores, but a difficult one, because the idea here is that people have different health literacy skills, and you want to meet everybody at whatever level that they're at. On the other hand, you don't want to stigmatize people. You don't want to set aside, oh, here are the people who need the extra help. And so one of the main ways that we talk about in the health literacy fields about addressing this is health literacy universal precautions. And it's just like when we talk about universal precautions for blood safety. You don't know whose blood is infected. You don't know, whether you're at risk. So you're going to treat everybody as if they might be at risk. Same thing for health literacy, trying to offer help to everyone. And the fact is that if you're adopting health literacy universal precautions, you're going to structure it as if everybody might have limited health literacy. Again, same reasons. You can't tell by looking. We saw with the prevalence data that people of all ages, and this is also true for race, ethnicity, education levels, that people have, the people who have limited health literacy do not stand out. And just because you actually have higher health literacy skills doesn't mean you necessarily understand, anything in particular. And even if you have, you're highly skilled and usually have great understanding, if you're ill, if you're frightened, if you're stressed, your ability to process, your ability to take in and act on that information is going to go way down. So that's why I say health literacy is a state, not a trait. And finally, best of all, is that actually everyone benefits from clear communication. The studies show when they have done interventions to simplify and communicate more clearly, people with higher health literacy also benefit. So, I wanted to suggest that you take a look at this Health Literacy Universal Precautions Toolkit. This is something that the University of North Carolina developed with ARC. And if there's one thing that you look at after this PowerPoint, this presentation, I hope it's this. I know I shouldn't have favorites, but this is kind of, I think, so useful. The tools that are in here are maybe 3 pages long, but they get across very specifically hands-on strategies that you can take to address health literacy in your practice. So for example, there's a tool on brown bag medication reviews. How do you get patients to bring in their medicines? How do you do the reviews? How do you make sure that it's happening institutionally? Here's an example of the Teach Back tool. It's a short overview, a single sentence on the purpose, and then they get into action steps and linking to specific resources that are available on the web or in the appendices of the toolkit itself about how to implement that tool. So, what the reactions that we got from practices that tested this toolkit was that there are certain tools that were totally mind-opening. So So like this one with the Teach Pack, people really didn't realize that their patients weren't understanding until they asked them to teach things back to them. The brown bag medication reviews, almost, every practice found many, almost all patients having some kind of medication error. And some of them were minor, like, oh, I didn't know you were taking that, fine, I'll add that to your med list. But others were really serious, like taking 2 different beta blockers and double dosing because you didn't realize they were essentially the same drug. And that happened in, a number of instances. So a lot of opportunities for improvement and a clear way to get there. So attribute number 8 is about access and navigation. And this can take the form of helping patients get to, the tests they need, to the specialty referrals, using clear signage, offering assistance, all of that to help people and create a welcoming environment. But the one that I'm going to provide you tools for is this last one about electronic information, because increasingly we are putting up information on our websites, we're referring patients to websites, we're giving patients access electronically to their own personal medical information, and it's not going to be worth anything unless that information is accessible, that they can understand it, that they can use it. So these are all links to sites like Health Literacy Online is a terrific guide from Ellen's office on how to create a user-friendly website. There's a checklist here specifically on seniors, the accessible health information for technology for populations with limited literacy goes beyond just websites. So, if you recommend or purchase glucometers or, other kinds of home monitoring devices, what are the considerations for those? And finally, we have to train people how to use these technologies, that giving them a URL, giving them, saying, go use this EHR, PHR, personal health record, is not enough. And so the last one is a toolkit to help train patients, in particular seniors, on how to use these systems. Attribute 8 is kind of the big obvious one of health literacy, because it's talking about print material, audio, visual material, needs to be easy to understand and easy to act on. So we talk about actionability in terms of, after you're done reading it or viewing it, listening to it, do you know what you're supposed to do at the end? And a key to this is testing it with patients. So even if you haven't developed it, if you're trying to decide between 2 different pieces of patient education materials, ask your patients, see what they say is easy to understand, what they know what to do. And if you're translating into other languages, make sure that that's a quality translation process. And I'd be happy to answer questions later about what I consider to be a quality translation process. You can also think about creative ways of presenting information that isn't just blocks of text. So here's another tool from our Pharmacy Health Literacy Center that shows a pill card and how you could visually depict when and how much medicine to take. So thinking about strategies, and so what's on the health literacy site is a manual for how to create these cards. There are also a lot of guides and toolkits for writing and clearly, effectively, in plain language, etc. This one is my current favorite. It's on the Centers for Medicare and Medicaid Services website. And while some people find it a little daunting because there are 11 parts and some of them are rather lengthy, it really practices what it preaches. And so it's very easy to find the kind of information that you are looking for, whether it's formatting ideas and design ideas, or writing standards, or testing. Just go to that part of the toolkit. So, vision for the future. This is the vision that's put out in the National Action Plan to Improve Health Literacy that was published in 2010. And I hope, everybody who's listening would join me in hoping that we can together achieve a society that provides everyone with access to accurate, actionable health information, that delivers person-centered care, and that supports lifelong learning and skills to promote good health. And if we can do that, we will break through that cycle of crisis care that I mentioned before by making sure that, the scheduler is reminding people about what to bring to the visit, that our forms are easy to fill out, that help is offered, that we listen to patients, that we use easy-to-understand language, that we discuss options and trade-offs and solicit questions and come to shared decision-making with an agreement on a treatment plan, and does that confirmation of understanding of that. And then provides the back-end help of, providing information that can help getting them to appointments and doing follow-up regularly so that we don't loop back into that crisis and end up with patients hitting the hospitals because they've fallen out. So if you have become excited by all this and want to not only sort of, raise the health literacy banner at your own organization, but want to connect with other people in your area who are doing work on health literacy, the Centers for Disease Control and Prevention has a list of health literacy collaboratives around the country that you can look at. So just click on that little map, yellow underlined map there, and you'll link to that site. We also have some health literacy resources on our ARC website, and you can sign up to receive email updates, which are maybe once or twice a month. We send something out when there's a new, research finding or tool that we want to let people know about. So I'm going to sort of close here with a quote from our Surgeon General, Regina Benjamin, that says, if patients' understanding is incorrect or incomplete, we did not find the right way to reach them. Being health literate is just as important for clinicians as it is for patients. So I'm not going to ask you for questions right now, but I'm hoping that you are busily typing them into your webinar browser, and I'm going to turn the ball over to Ellen to pick up the rest of the presentation, and then we'll try and answer some of your questions.
Thank you, Cindy. Okay. So as Cindy said, I work for the Office of Disease Prevention and Health Promotion, and our office is also very active in health literacy. She did mention one of the tools that we have online to help people design websites that are health literate friendly. So a little bit more about our office. We do a lot in health literacy, both in services and in policy. And from a policy perspective, our office is involved with co-authoring articles that have been featured in the journal Health Affairs, which Cindy mentioned, talking about health literacy from a systems perspective and talking about what a health literate care model would look like. And I believe Cindy showed a picture of that in one of her last slides. We also take an active lead in the implementation of the National Action Plan to improve health literacy, working with Cindy at ARC across the Department of Health and Human Services. And from services perspective, I mean that we work really hard to incorporate these health literacy principles into the products that we create. And the website I'll be talking about today, healthfinder.gov, is an example of the implementation of health literacy principles. So the objectives for this short presentation include what HealthFinder offers for older adults, how community health centers can use HealthFinder resources with their constituents, and how to use the My HealthFinder tool to find information about preventive services covered under the Affordable Care Act. So just a little bit of history on healthfinder.gov. The site was actually created in 1997, and it's gone through multiple iterations to be really focused on wellness and prevention. It started as a portal of links to trusted websites and healthcare organizations, both within the federal government and in the nonprofit world. But it's really focused on prevention and wellness. It provides user-tested, easy to understand, and really important, actionable information on prevention and wellness topics based on up-to-date scientific guidelines. So the site was designed to be easy for the public to use because we know that many people, as Cindy said in her presentation very eloquently, struggle with the complex health information found online and other places, in the doctor's office, in print brochures, wherever. And this site includes prevention and wellness information that has actionable information and provides other links to interactive tools and resources if the user wants more information. Most health information websites are organized by disease or by body part or by symptoms, and they focus on disease management or treatment. And HealthFinder is a little bit different in that it's organized around the actions that people can take to stay healthy. So the two parts of the site that really make up our prevention and wellness content and what I'll be focusing on today are Health Topics A to Z, which you can see on the screen, and the My Health Finder tool. So a little bit more about Health Topics A to Z. It's organized under 6 overarching categories, as you can see here, but it also gives users the option to browse by population on the bottom or by an A to Z index. We did find in our usability testing that a lot of people go straight to an A to Z if they know exactly what they're looking for. However, we wanted to give people more pathways to the information that they might be looking for, and so they can browse through different categories or they can go straight to a specific population. And within this content, there's over 100 topics and tools for prevention and wellness. So what resources do we have for older adults? So as I mentioned, Health Topics A to Z has 3 different ways of navigating through the content, by A to Z, by overarching categories, or by population. And you'll see that we have a section dedicated to older adults with topics ranging from visiting the doctor to physical activity and nutrition to safety. So drilling down into one of these categories, here we're in the nutrition and physical activity category. It gives you all of the content related to that category. You can see here that the main topic under physical activity and nutrition for older adults is maintaining health by staying active and eating healthy. You can find more related information, like a topic on how to eat healthy, how to get active, and a link to view all of the information related to nutrition and physical activity. Of course, not all of the information is specific to older adults in nutrition and physical activity. Healthy eating and being active is obviously for everyone. But in the topics specific to older adults, you'll find tailored information and links to specific resources for this particular population. And examples include additional information from the National Institute on Aging, their Go for Life campaign, which is a campaign focused on increasing physical activity in older adults. The NIH Senior Health FAQs for eating well, obviously Medicare.gov and Healthcare.gov for information on coverage and prevention under the Affordable Care Act. So inside the topic, there are 2 sections. In each topic, we have the basics, or what the topic is about, and why it's important, and then take action. So when you click on Take Action, it gives people tips and tools on how to actually take the next step. So what is all this information? Why do I care? And then what do I do about it? So our Health Finder A to Z topics really synthesize information from across HHS. And we know that there's a lot of information on prevention on a range of different topics. And it boils it down to the basics, what you need to know, why it's important, and then what to do about it. And this is really important, especially now, because there's an abundance of health information out there, and the renewed focus on prevention under the Affordable Care Act, it becomes really increasingly important to find trusted and reliable information online. So the next 2 objectives I'm going to cover together, and the next slides are going to show you some of the tools we feature and how to use the My Health Finder tool to find out about recommended preventive services. So community health centers can use the information found in the topics that I looked at earlier, but they can also use the tools that HealthFinder provides to help their constituents put prevention into practice. So on this slide, you'll see that some of the tools we feature include shopping lists for healthy eating, quick tips that can be printed out. So this one is about how to get active and what the recommendations are for building activity into your routine. And then questions for the doctor to prepare for important appointments. And these ones are more specific to the older population. So talking about preventing osteoporosis and prostate cancer screening, whether it's a good idea. You know, am I at risk for it? Should I get screened? Should I not? And so we're arming people with the tools that they might need to go to the doctor and start a conversation about the care that is best for them. So what is this My Health Finder tool I keep talking about? My Health Finder is a tool that provides personalized recommendations for clinical preventive services specific to a user's age, their gender, and their pregnancy status. And this feature was actually developed through a joint effort between the Office of Disease Prevention and Health Promotion and ARC, where Cindy works. And it provides evidence-based recommendations from the U.S. Preventive Services Task Force, which is an independent panel of experts that provide recommendations from the Guide to Clinical Preventive Services. So My Health Finder results include all preventive services covered under the Healthcare Reform Law, and this means that recommendations also come not only from the U.S. PSPF, but also from Bright Futures for Children's Preventive Services, the Advisory Committee for Immunization Practices, and the Institute of Medicine's Committee on Preventive Services for Women. And each of the recommendations links to content in our Health Topics A to Z. So let's look at the tool in action. You'll see here that I'm using the example of a 65-year-old woman. I choose female, enter I want information for myself. There's a drop-down. You can look for someone else or you can look for your child. It doesn't ask for any other personal information, so you're not personally identifiable. And I get the results of my input on the next page. So you can see that what the doctors recommend for all women age 65 include, you know, getting a bone density test, getting your pneumonia shot, and you can see after the recommendation that it tells you which task force it's coming from. And so you can also see that all of these recommendations link to Health Topics A to Z. So if you want to find out more information about that particular topic, you can click through and see what that topic entails. And if you scroll down, so this is at the top of the page, all women age 65 should get these different screenings. And then if you scroll down a little bit more, you can see that there's also recommendations based on family history and other risk factors. So, you know, not everyone may be need counseling for quitting smoking, but if you do smoke, obviously that might be a recommendation to talk to your doctor about, getting your cholesterol checked depending on your age, and how often you've had, or how previously you've had it done. So that's what the My Health Finder tool is. And then all of those things are covered under the Healthcare Reform Law. And Health Finder, during our refresh that was mentioned at the beginning of this webinar, we created a landing page that really talks more in depth about what the Affordable Care Act is. A lot of people still don't really recognize it from calling it the ACA or Affordable Care Act, so we've called it Healthcare Reform to make it a little bit more understandable about what it is, and what it covers, why preventive care is important, what is preventive care, and it gives them ways to learn more about those services. So Health Finder has all of the consumer information on all of the covered preventive services under the ACA, and someone can come here, look at it, see which population is for them. Are they an adult? Are they a woman? Is she a pregnant woman? Are you looking for information for children? And you can go to each landing page to find out what's covered. And as you can see on this screen, the check marks include what the actual screenings are that are covered, and then the corresponding topic that's featured on Health Finder to learn more about it, if it's for you, and a little bit more information. So that is pretty much it. And Cindy and I welcome any questions you might have.
So Tricia, are you going to tease up the questions, or would you just like
yes.
us to read them and proceed?
I can read them to you, and thank you, Cindy and Ellen, for that really great presentation. It was a wonderful presentation. I learned a lot from it. So my first question is to Cindy. Does health literacy have a cultural competency component?
It's a terrific question, because I really think of health literacy and cultural competence as overlapping Venn diagrams. In other words, there are parts of health literacy that aren't really cultural competence, but a lot that they have in common, and then parts of cultural competence that don't. The most obvious part is when you're dealing with language barriers. So clearly, when people are speaking other languages, when limited English proficiency is a factor, your health literacy in English, which is how most of the communication is occurring, is going to be low. It's also clearly a cultural competence, because we think of linguistic competence as being part of serving diverse populations effectively. There are other pieces, though, and we actually, in the Health Literacy Universal Precautions Toolkit, included a tool that, excuse me, that is about cultural differences. And we felt that it was an important part of health literacy per se, of understanding different ways that different cultural groups communicate in order to be an effective communicator and to address health literacy. So, so how to address language differences is a tool in the toolkit. Culture and other considerations is a tool in the toolkit. And the training that I had mentioned that HRSA offers spans all three of these: the health literacy, the cultural competence, and the language access piece as well.
Okay, great. I have another question for Ellen. Is funding available to train older adults to use computers?
That actually might be a question for Cindy as well. I mean, the Office of Disease Prevention and Health Promotion doesn't provide grants. We don't provide money for the public. I mean, certainly we design our websites to make it easier for people to use, but I'm going to pass that to Cindy as well. I don't know if you know of any grants that are available to train.
Yeah, I don't know about grant funding. The locale that I'm familiar that has done training is in senior centers, and that area Office of Aging is the place that I would look at for specifically funding for seniors in particular. You can also try and think creatively in terms of, are there any readmission prevention programs in the area, and would training seniors be able to help you get the information that they need to keep them out of the hospitals, and so try and tap some of the funds that are available for these readmission prevention programs. Things like that you can try and hook into to provide those services.
Okay. And a question is, we are a nonprofit agency that works with older adults and people with disabilities. We often create materials and outreach to help beneficiaries understand their health care. For example, Medicare, Medicaid, diabetes, self-management, etc. Any thoughts on how this idea of health literacy could apply to such consumer advocate organizations?
Oh,
Cindy.
Hugely. I mean, I'll jump in there, and then Ellen, you can add in. I mean, first of all, if you create materials, you certainly want to avail yourself of the guides that provide a lot of guidance in terms of, even selecting what information. A lot of materials just overwhelm people with too much you know, how you can use visuals effectively, you know, a lot of way of structuring information, and then testing it with your target audience. And again, that CMS toolkit that I alluded to as being my favorite of these kinds of guides, you know, helps you think about that structuring as well as how to test and things like that. On the outreach side, there are a lot of things that you can help those individuals with. So for example, my agency has something called the Questions Are the Answer campaign, of trying to help people go visit their health professionals armed with questions. So, you know, if you're going to be, you know, talking about medicine, that there are questions that you can ask, you know, sort of prompts of what are some of the things you might want to ask about, or if you're going to have a surgery, or, you know, just trying to help think through what you want to make sure you cover, prioritize in that visit that often, you know, goes by in a blink of an eye. Let's see, what are some of the other things? I mean, I would also, you know, I guess there's a question of, do you work at all with other, you know, the rest of the healthcare community, and can you serve as a change agent in that community to help educate those healthcare providers about the needs of your clientele and why, you know, they may feel overwhelmed and therefore not show up to their appointment because there's, you know, a barrage of print information covering all the bulletin boards, and the first thing is they're handed these stack of forms, and, you know, whatever it is that is an impediment to them seeking care and understanding it. Ellen, do you have anything that you particularly want to add on this?
No, that was great.
I mean, and you know, there are other things as well, but I want to get to other questions too.
So this is to Ellen. It's two questions. Does HealthFinder offer print materials? And if an older adult is not receiving the information they need from the site, is there a helpline for them to use?
Okay. For print materials, all of the topics and tools on our website are printer friendly, so you can certainly print them out, and they'll print out as they look on the site, but without the, you know, left navigation or the top search bar or anything like that. So those are printer friendly. And then in terms of if people can't find information that they're looking for, that's sort of a two-pronged answer. We don't have a helpline, but we do have an email address. So we do encourage people to email. It's on the Contact Us page, and it's healthfinder@nhic.org. So NHIC is the National Health Information Center, which we are congressionally mandated to have. But we also have a section of the site called Related Resources. We do find with a lot of the inquiries that come in, people are still looking for information on disease management, so we do want to link them to related resources that are trustworthy and reputable. So we have that part of the site that people can search A to Z for different organizations. And we do find that a lot of our inquiries are about specific insurance coverage as it relates to the Affordable Care Act. So we either direct them to healthcare.gov or have them call their own insurance company.
Okay, thank you. For Cindy, other than 508 compliance, are there other guidelines to help health providers design materials and signage that can increase health literacy and comprehension?
To be honest, I don't know of any about signage. I know a number of healthcare organizations have done work on signage. There's something called the Universal Signage Project of Hablamos Juntos, which means speaking together in Spanish, where they tried to develop icons that were cross-cultural and found it incredibly difficult that, if you just think about, let's say, the elevator icon with a box with little arrows going up and down, I'm sure if you just show that to people fresh, they wouldn't say, oh yes, that means elevator, but we've come to learn that that means elevator, but that they did develop some icons to try and help with what we call wayfinding, of making your way around. But I don't know any guides on that per se. What health systems usually do is do walk-arounds with their patients, and their patients say, that's confusing, I don't understand that, I couldn't find my way, etc. For the other pieces, absolutely, so that there are a lot of guides about designing materials, and there's the CMS guide that I highlighted in my presentation, but there are also several other guides. I believe actually there are links from Ellen's office's website. The Office of Disease Prevention Health Promotion has a website on health literacy improvement, and there are a number of tools and resources there, so that the National Cancer Institute has, there's one called Simply Put that the CDC has. So again, a lot of these are listed in the 10 attributes paper that I mentioned. You also can probably find them in the Universal Precautions Toolkit. We have a Tool 11 called Design Easy to Read Materials that can link you to some resources there. So a lot of help along those lines.
Yeah, that's actually the website that you were referencing is health.gov, and there's a whole section on health literacy, health communication, health literacy, and e-health, and there's featured tools and resources on that website.
Okay, this is for Cindy. Is there health literacy training for providers?
Yes, there is. The training that that I mentioned that's free, which is terrific and available on the web online, that HRSA provides, and that's available for continuing education credit. But there are other ways to get educated. From, you can take a do-it-yourself approach. So one of the tools in the toolkit is called Raise Awareness. And there are links to various health literacy videos that are available on the web, an actual PowerPoint presentation, and a discussion guide for viewing these things together as a group during your lunch hour or after work one day, and then having a discussion about what you're seeing and how it relates to your setting, and what does it make you think about and want to change. There is a very large program on cultural competence that's available at, I believe it's thinkcultural.org. That isn't health literacy per se, but is another way of getting continuing education credits for this kind of self-driven education. And then there are other possibilities like inviting experts. Oh, I just got a feedback loop there. Sorry. Inviting experts to come and speak in your settings, to engage patients, to help teach you what it is that they need and they find challenging. So again, many different ways of thinking about how do you do training and educate yourself.
Okay, and it looks like this might be our final question. This is to Cindy as well. Have you tried the toolkit and resources with other populations?
I'm not entirely sure with other than whom, so let me tell you how the toolkit has been tested and is continuing. We had the toolkit tested with a number of different practices. So they were pediatric practices, there was, CHC, serving Latino community primarily. There were residency practices. There were, small, a few docs practices. So, family, internal medicine. So, really, a bunch of different groups had tried and provided us feedback when we were developing the toolkit. Since then, the toolkit's been taken up in a number of different health literacy collaboratives. So one collaborative in North Carolina used the toolkit throughout their health system. So they used it in long-term care settings as well as adult and pediatric and other kinds of residential settings, etc. I actually just got an email this week that the adult health education centers in Kentucky are using the toolkit as a basis of a series of educational sessions and planning sessions with a group of practices there. So there are a lot of different populations in terms of types of providers as well as types of patient populations that the toolkit's been tried with. And right now we're just starting a demonstration of the toolkit in 12 different practices around the country. Again, diverse types of practices to really see and study the implementation process, and our plan is to come out eventually with a version 2.0 of the toolkit that learns from all of these experiences.
Okay, great. I believe that's the end of our questions. Unless Cindy or Ellen, if you have anything else to add, I would like to say thank you to our attendees for participating in this webinar, and we are very thankful for Cindy Brach and Ellen Langhans for taking the time out of their day today to present this important topic to your health centers and to all senior advocates that are providing services to senior communities across the nation. It's important to make sure that we all keep our patients safe when we are treating them and preventing diseases across the country. I would like to say thank you on behalf of everyone here at North American Management to Cindy and Ellen. And if you have any questions or if you need any training and technical support, please contact us. Any one of our talented staff members, and we are here to help you with any of your questions. And I would like to also announce that we still have registration seats available for our National Primary Care Symposium on Aging that will be this Monday, or coming up Monday, April 15th, in Arlington, Virginia, at the Key Bridge Marriott Hotel. If you have any questions about that symposium, please give us a call, and we can give you more information. Other than that, please have a great day, and call us if you need anything. We are here for you. Cindy and Ellen, thank you very much for everything.
Thank you. Oh, you're very welcome. It's a pleasure to be here.